John. Let's get started.
Good afternoon, everyone. On behalf of the American Geographical Society Council, our members and the staff, it's my pleasure to welcome you to this special leadership spotlight focused on digital contact tracing tools with Ms. Maria Barsallo Lynch, who is the Executive Director of the Defending Digital Democracy Project at Harvard Kennedy School Belfer Center, and Ms. Lauren Zabierek, who is the Executive Director of the Cyber Project, also at the Belfer Center. To those of you participating in the conversation on WebEx and those that are watching our live stream on Facebook, it's great to have you joining us this afternoon. We are proud to partner our EthicalGEO initiative with the Henry Luce Foundation to investigate the societal implications of geospatial technology and location tracking. Multiple mobile location-based applications have become ubiquitous in our society. As all of you know, they have changed the way we live our lives in a very short period of time. There are, however, problematic and unanticipated effects of using this technology. To better understand the ethical implications of its use, we have provided this platform to frame the discussion and to address these issues. They are already impacting our lives on a daily basis. COVID-19 has put a spotlight on the concept of using mobile tracing and surveillance to fight the pandemic. Around the world, the utilization of this technology to fight the coronavirus is being employed to various degrees, and already governments and people worldwide are faced with the issue of compromised privacy and what that means as we go forward. Over the past several weeks, we have convened 5 blue ribbon panels and looked at the ethical implications of mobile location technology and the impact on vulnerable publics from an international perspective and from the unique American experience. In addition, we had a panel of national security leaders who focused on mobile tracing technology and its use in national security and the impact on democracy. And this past week, we heard from state and local leaders who shared their invaluable experiences with us and from experts on the issue of data quality and building trust. In the case of all of the panels, the discussions were eye-opening and extensive. We also had the opportunity to hear from Ambassador Samantha Power in a leadership spotlight session, and she added the human rights aspect of the use of mobile technology. Today, we turn our focus towards what has already become one of the seminal studies investigating the use of digital contact tracing tools being used to combat the pandemic. The findings of this study are sure to serve as the base of information and data that policymakers will use to help guide us in the future. Before we move on, I would like to explain to those of you on our WebEx platform the best way to get the most out of today's discussion. For those viewing on a desktop computer or laptop, we recommend that you customize your viewing by hovering the mouse in the top right of your screen and selecting the icon in the middle. From the 3 options shown, please select Grid View for optimal viewing. During our Q&A session later, to ask a question, hover your mouse under the arrow and click on the question mark icon in the gray bar at the bottom of your screen. For those of you that are using a tablet or mobile device, select the icon with the 3 dots, which will then allow you to select the question mark icon to submit your questions to our panelists. And now, it is my pleasure to introduce Dr. Marie Price, the president of AGS and our moderator for today's session, Ms. Maria Barsallo Lynch and Ms. Lauren Zabierek. Welcome to all of you. Marie, we're looking forward to your conversation.
Thank you, John, and thank you so much to our speakers, and welcome to our listeners out there. I'm going to give a brief introduction to our speakers. We have some prepared questions, and we hope to allow for some questions towards the end of our hour. Both of our speakers come from the Belfer Center for Science and International Affairs at Harvard's Kennedy School. Maria Barsallo Lynch is the Executive Director of the Defending Digital Democracy Project. She brings a background in politics and the cross-section of cybersecurity and technology with a focus on providing solutions and tools to keep democratic processes safe. She has worked in the nonprofit and government sectors, including as a legislative fellow to U.S. Senator Richard Blumenthal. Born in Panama, Maria holds degrees from Colorado College and Harvard. Our second speaker, Lauren Zabierek, is the Executive Director of the Cyber Project at the Belfer Center. She has served as an intelligence officer in the United States Air Force, Later, she was a civilian intelligence analyst with the National Geospatial Intelligence Agency for 6 years. And after leaving NGA, she has joined the cybersecurity threat intelligence startup Recorded Future and was instrumental in building its public sector business practice. She joined the Belfer Center after completing a mid-career MA with the Kennedy School in 2019. Ladies, as you probably know, this spring we convened, we've been involved this summer, actually in spring, in bringing together people who can inform us about the use of location tracking. And we know that this spring you convened a working group that brought together partners from technology, different levels of government to fight COVID-19 in the US. And we are happy to note that one of our earlier panelists, Sue Gordon, also served in your working group. The group produced a report titled Considerations for Digital Contact Tracing Tools for COVID Mitigation, Recommendation for Stakeholders and Policymakers. And in order to get our audience up to speed, I welcome you to do a brief presentation about your key findings and recommendations before we go into questions. So it's all yours.
Thank you so much,
Dr.
Marie.
Price. Thank you so much for having us. Sure. Hi, everyone. We just wanted to thank everyone for having us on the panel today to discuss our report as well as our considerations for digital contact tracing tools that we pulled together. As Dr. Price mentioned, after this particular working group, we wrote this report and really convened the working group because, we saw a lot of different efforts in the space to use technology to track and help mitigate COVID-19. And so, we just wanted to ask questions of various stakeholders from the federal government through technologists, through other tech experts, et cetera, to really understand what the space was. And what we ended up with was this particular report on digital contact tracing. There are a number of other technologies that we discussed, but we decided to focus on the digital contact tracing aspect of it. Maria, did you want to mention anything?
I think we just feel incredibly lucky to have been able to have that initial conversation at a time where everything seemed so new. We had been in conversations in March where the idea of something like digital contact tracing seemed very far off and is now a very real potential solution in the mitigation efforts against COVID-19. So it's been great to have these conversations and then also to see how other collaborators or experts are thinking about working on this or advising decision makers too. So we hope that this report makes it really accessible to both understand the technology that's being considered and the implementation realities. And we also welcome your feedback for things that are helpful to better understand.
Absolutely. Next slide, please. We just went through who we are, so we can go ahead and skip this slide. Okay, so, a lot of people on this particular call might not even know what digital contact tracing is. We certainly didn't prior to actually pulling together the working group and then doing the research for the actual report. But essentially, the digital contact tracing piece is really the use of technology, whether that's through one's cell phone, or we've seen the use of like bracelets or pendants or something like that, as well as a software application, or in the case of the Google and Apple API, an operating system modification. And then there's a whole back end, needed to have this be functional. And that, helps to either track location and or proximity to another device, which serves as a proxy for another human to notify for potential exposure. Maria?
Thanks,
And
Lauren.
then this, yeah.
Oh, sorry. I was just unmuting myself. And Lauren, please redirect as well. One thing that we felt incredibly important to stress, not only throughout this report, but also throughout our conversations, is that the idea and the methods behind digital contact tracing, which we'll talk about in just a moment, are really in an effort to support and supplement manual contact tracing efforts. They're not intended to replace them, or we don't think it would be as successful if that's the intent. We really stress a collaborative and coordinated approach in employing digital contact tracing methods. And whether it's digital contact tracing or manual contact tracing, as we are seeing with reporting, it is incredibly important that testing and the accuracy and availability of testing continue to be a solution that is focused on, because manual contact tracing or digital contact tracing won't be effective if testing is not effective. And next, we'll go ahead and go to the next slide. So before we dive into the technology, we'll give a quick 101 about some of these methods. We just wanted to highlight up front both the challenges and opportunities that digital contact tracing methods are raising questions around. You know, you might hear in some of these conversations, is it even worth doing? Will it work effectively? We'll talk a little bit about why those questions exist. But generally, we've highlighted here, we think, some of the greatest challenges for digital contact tracing being effective. We'll talk a bit during this presentation about privacy and what privacy considerations there are, not only within application development, but then how data is stored and utilized. There are really kind of interesting nuances there. And then we talk a little bit about the security of handling this data, of setting up certain systems. Not only in both methods, there are going to be different systems that you will need to kind of think about setting up, and processes to support those systems, both whether it's hardware focused or people focused. So really having clear standards around security will be important, and we'll talk about that a little bit further. Lauren, would you want to add to especially the security element?
Yeah, absolutely. So, you know, there are kind of two aspects of this, you know, both from, you know, within the app environment, but then also when any data sort of leaves, you know, either the solutions and is utilized by the manual contact tracers. But overall, you know, we know that this data would be a very attractive target for cyber actors, whether criminal, nation state, et cetera. And so, you know, we talked a little bit about the trust and buy-in aspect, and as states are thinking about setting up these programs, you know, they really have to take into account the security of this data. And, you know, especially, you know, throughout the years and, you know, even through last year, you know, states and the data that, you know, they hold and try to secure has been a real target, you know, especially in the ransomware market. So, so definitely a really important consideration for states. The systems, for instance, you know, really need to be worked out as well. So we'll talk a little bit about this in, you know, especially in the Google and Apple solution. But, you know, there's a call for the use of decentralized servers, and you know, while that is very privacy preserving, that also creates mobility challenges. And so Maria will talk about that. And then a big question that we've heard from a lot of people, you know, stakeholders and experts, is what works? Is this effective? Should people in states and officials even be making this particular investment? Because we know, you know, between time and money and people, et cetera, it'd be quite a big investment. And then finally, a huge factor that I think we just mentioned is the public trust and the uptake. We need to get public trust and buy-in to make sure that we're, you know, being as effective as possible. But, you know, when you have, say, multiple vendors pitching different states, or you have coordinated disinformation campaigns, you know, going after people and different solutions, that can be a real issue.
And the last thing I'd note here, too, is that I think we see some of these challenges as really interconnected, even though they each kind of offer, there are certain considerations for each. Getting each of these right is important for the success of implementing digital contact tracing. We'll go to the next slide. So there are a lot of opportunities as well, even though I think right now predominantly there are real conversations around the challenges of implementing this. We think, you know, in summary of these items, there's really an opportunity to have real-time information and data that will help both decision makers and individuals understand their next steps in mitigation efforts, and we've seen that be successful in some cases. I think there's a opportunity in terms of the connectivity and information exchange that can happen between public health officials and individuals if an application and if a method is really integrated well with manual contact tracing efforts. That will also support mitigation efforts. And we think also just being able to have a more real-time picture of how quickly this virus is moving is a helpful element. And Lauren, I'll hand it over to you for some thoughts on the last series of opportunities that we listed here.
Yeah, absolutely. You know, just we know from the ubiquity of technology in our lives, this can really help with time and scale and reach. So technology would help to provide the ability to reach more people in a faster manner. You know, again, pending uptake of the solutions. You know, the other thing is really peace of mind. You know, I know for myself, if I'm out and, you know, I'm wearing a mask and trying to distance, et cetera, and then I had a solution that could tell me, you know what, you were not in contact with anyone who tested positive for COVID, or maybe you were, and that sort of alleviates the need to, you know, sit and really worry about it for days and think about, okay, am I developing symptoms or not? So certainly, you know, this technology is not a silver bullet. It is not a panacea. It is meant to assist, as we said, the manual contact tracing efforts and of course, overall COVID-19 mitigation efforts. But, you know, there are some potential opportunities for this particular technology.
We'll go to the next slide. I'm sorry. So we'll go ahead and give a quick overview of both of the methods that are generally being considered to implement digital contact tracing. So the first, and likely one of the methods that you may have heard of, is both Google and Apple's partnership to create an exposure notification API. And an API, which we should pause and explain too, and I may not be the best explainer of this, but it's a way essentially for applications to grab Bluetooth data that Google and Apple have collected from mobile devices that are affiliated with them. And it's a set of functions and procedures that allows for these applications to access that data on those operating systems. So the reason that Google and Apple's exposure notification solution has been considered incredibly one of the more privacy preserving options is because of how it uses Bluetooth, a Bluetooth protocol, and it's enabled these devices to capture the chirps. You've probably heard that a lot in the reporting about this. So when devices are in close proximity to each other, an enabled device that has Bluetooth on will have a chirp, and devices can exchange these respective IDs. And that's locally stored on the devices in an encrypted form. And then that data is available to applications that use this API. So because it's encrypted and anonymized, it's able to then, that's why it's considered privacy preserving. And I'll make sure that if Lauren has other thoughts too in trying to break down the granularity of that technology, we can highlight that here too. So one thing that we'll mention about why it's considered a predominant solution, not only because it's privacy preserving, but also because of the protocols that are underlying the technology Google and Apple have been working with MIT Private Automated Contact Tracing PACT, the PACT team. It's a group of organizations that are coming together to better give accuracy to how Bluetooth is able to detect, how the devices are able to detect each other. And that gives it some somewhat more accuracy. So something that you may have heard about the Bluetooth methodology is that sometimes there might be false positives, or there's a certain amount of potential for error in understanding the proximity. So there are some of the world's kind of foremost engineers working to figure out the proximity element of this. So what's great about the solution is that it offers this privacy. And when we talk a little bit about location services, which Lauren will also talk about as an alternate method, Bluetooth on its own offers some accuracy, but may not offer as much accuracy as the other methodology. However, it does offer the privacy component. Now, in order to really make this technology work, there is some requirement to really set up and program servers at states to be able to handle the data. And if we could actually, we have two images that we've included in the slides. One here, I think it's from MIT PACT, and in our research was one of our favorite kind of images because it shows the ecosystem that states need to consider beyond kind of pulling the data that would help understand who might be exposed or have tested positive. There are some either technology connections and also people processes that would need to be put in place. So whether it's a person individually reporting in an application or their health provider reporting that they have tested positive in order to then aware other people that might have come into contact with that phone identification. So this kind of is one example of what a system could look like if a state decided to implement this method. Because the data exchange is tied to health servers, and there's some discussion around whether this is a centralized health server in the state or decentralized within a state, it really creates some mobility problems like Lauren mentioned. We call it in the report the airport problem, because when you have people who then start to move between state lines, that will become difficult. There won't be a way to track the kind of potential exposure while they're in transit. So we'll talk a little bit about some of our recommendations, but coordinating across states to deal with this mobility problem and the potential ability to capture data is going to be really important in the long term. We'll go to the next slide, and I would love for Lauren to add in anything I may have missed about the Google and Apple exposure notification method.
The only thing I would just add is, this API, this software operating system modification it's out there, but really states are responsible for building an application that goes on top of it. And whether that's through their own technologists or through hiring, particular vendors. And so we know that Google and Apple have to vet that particular piece of software. But again, just another, opportunity for states to really come together and standardize and create guidelines and talk about their different requirements and needs.
And I think you touched on something really important there, Lauren, which is that in using this potential method, an app needs to be developed in order to take advantage of the data, and public health officials are really central to that process in granting, kind of choosing the app that will be used in a state. And so working we'll talk a little bit more about some of our coordination observations, but that will be incredibly important. The development of that app that interfaces with this data is an important part of this. Next slide. We'll go ahead and go to the next slide. And apologies, because I think we also talked a little bit about some of what's on this slide ahead. So we'll go ahead and go to the next slide. and discuss location-based solutions.
Thanks, Maria. So the other particular solution that we looked at was more, the location-based applications solutions. And we looked at a couple specific apps themselves. So essentially what the location-based solution is using the, cell phone with Wi-Fi, the location services on the cell phone, Wi-Fi, and some of the inherent Bluetooth technology that's already on the phone. So without any sort of, further development of that particular technology from Pact or Apple and Google, it's just whatever is on the phone already. Essentially, they're using location trails or pings or whatever to compare user locations with infected individuals to identify potential transmission areas, and then of course if those locations have overlapped. One of the specific technologies we looked at was SafePaths, which is a group that was affiliated with MIT. And that particular technology generates GPS trails to match time-stamped and personal location history with infected but patient anonymous trace files provided by public health officials. And that's through the app, through different interviews, through pulling, that Google location data. As Maria was saying, this does solve the airport problem because there's no decentralized server issue to reconcile. It's just, it's just tracking you based upon your phone, essentially. So it's not, dependent on another server or from a decentralized point of view or anything like that. Next slide, please. So some of the data and privacy considerations. With SafePaths, if you saw from the previous slide, they definitely go through some great lengths to say, this data is encrypted at rest and in transit, and other considerations. But in reading through some of the documentation, we saw that the government entity is actually responsible for redacting personally identifiable or personal health information. That to me raised some red flags. So they're equipped with a tool to do so. And that's really dependent, I think, upon, whether this government is at the state level or across the world. So like any particular government can actually white label the solution here. So for me, raises a red flag, as I said, especially right now. Public trust in governments is obviously a huge issue. And really we need policies and protections to ensure that no nefarious actors can really access such data, whether, again, in the government or trying to actually access it from the outside. And then, of course, the integration with manual contact tracing systems and operations, their personnel as well. We need to really consider that when that data actually is maybe outside the app system and then is being used by manual contact tracers. There were some other apps that we looked at as well. One of the foremost ones that we looked at was one called Healthy Together, which was developed for the state of Utah by the social media company 20. And I recently learned that their underlying locational technology was actually from Foursquare, which I'm sure many of you are quite familiar with. And, there's a huge issue because, there's no national data privacy and security law. And so, especially when these states are working with social media companies or early tech companies, they have to know exactly what they want out of this app. They have to know exactly what data security and privacy restrictions that they want to implement. So even though the Healthy Together app specified, users can delete data at any time, it's limited, it's encrypted, deleted after 30 days, which sounds good, I think. There still could be some privacy implications, that we are just not aware of. And if you go to the next slide, I'll kind of explain why, even though I think this group probably understands. So this particular report came from the New York Times back in December of 2019. And as you can see, they actually bought a data set filled with the location of millions of Americans and their cell phones. This, on the left, you have this picture here at the New York Stock Exchange, but they were able to isolate down one particular smartphone and then track that particular smartphone across the region. And so that's what we mean when, these tech companies, they really don't have any laws to guide, how they collect, store, sell that data. So we definitely see an issue with states as they're trying to deal with, multiple vendors, trying to sell them software development, and really, whether or not they totally understand the privacy and data security requirements needed to protect their citizens and their people who live there. Next slide, please.
And I'd add, while we're transitioning to the next slide with the location data, that we note in the report, kind of some of the, whether it's the location data or the other method, that considerations like the fact that HIPAA, the Health Insurance Portability and Accountability Act, doesn't extend to tech companies acquiring data directly from consumers. And, even if the Consumer Privacy Act has certain privacy policies that vendors might be using, there is a kind of a big area of vulnerability in terms of health data, and that there not being any kind of legislative solution or regulatory solution there about how that data is utilized. We think, and we didn't cover this in the report, but we understand at the local level, in terms of what demographic data public health officials are able to collect, there might be some potential safeguards, or there might be some challenges in even collecting demographic data. So it's small questions, but big questions like that we stress it's so important to have an integrated group that is considering the technology, working with public health officials in manual tracing efforts, because the development of this app and being truly helpful for our state's mitigation efforts will really have to be aligned to what data is helpful for officials that are using that data.
Absolutely.
Maria and Lauren, that was really a fascinating summary. We have a link to the report. I highly recommend it for people who really want to get into the weeds and how this technology is used. And I think one of the things that we hope to get out of this project is our guidelines for how, under what circumstances this technology could be used, not just in the US, but in other parts of the world. And the project we call the Locus Charter, which we're working with the Benchmark Foundation in the UK, because it's quite conceivable, not just COVID, but other natural disasters or future pandemics. We're going to need to know how to harness this technology in a safe way, both in terms of privacy and for governance. One of the questions I have is that you conclude that the digital contact strategies only work if you have public trust and buy-in in the technology and widespread and rapid testing. When you wrote this report, we were in the United States, we're on a downslope in terms of numbers of cases. Then July surprised everyone with the record numbers. So I would ask you, do you have any examples anywhere in the US where those sort of questions of trust and trust in the technology and widespread testing, whether it's a local government or even institutions, have been able to meet that standard that you set out?
I'll just jump in and sort of address from the outset. I would say the short answer is no. The long answer is, there are some states like Massachusetts that have made significant investment in testing and contact tracing, which is really important, but that's obviously not a uniform condition. You mentioned institutions, and I think it's really interesting to see sort of smaller environments test this out. So for instance, at Harvard, they have a really, I think, strong and robust approach to the overall issue. So for instance, they are making self-administered tests very accessible across campus with drop-off points. And supposedly those results will be reported back in 12 hours, and they're requiring, multiple tests per week. And they're requiring a digital contact tracing app that is location-based using Wi-Fi, to be used. And, on campuses or, with different employers, I think it's, you're sort of giving up a little bit of your privacy because you're in a situation where, you really have to think about the public good. But I think, with the rapid and widespread and accessible testing, I think is a really huge piece underpinning any sort of success in this area. Mm-hmm. Maria?
Yeah, I think that's an excellent point, Lauren. And I would add, even if some of the apps that we talk about have been adopted and are in use, we are still kind of waiting to better understand the acquisition of how those apps are used. And I think more generally, as we hear reports about manual contact tracing efforts, there are two things that really stand out to me, at least from the perspective of what we discuss in this report. One is the reports around manual contact tracers having a lot of anger directed at them for their work in trying to contact individuals and request information. And that speaks to this lack of public trust. And, how is the communication with the public part of your holistic strategy? And even if it is part of your holistic strategy, just that element of it with manual contact tracing efforts alone is something to really seriously consider. The other piece that we don't cover in the report, but we know is something that is in place with manual contact tracing efforts, is that there are elements of technology, not digital contact tracing methods, that are really making it more effective. So for example, getting a text message versus a phone call, or some different ways that people are getting communicated with. It's an interesting thing to analyze, especially as we look at how that integrates to applying some of these potential methods as well.
Mm-hmm. Another really important part of your report is talking about the coordinated response with different stakeholders. And so it's a very complicated relationship. You've got private sector companies, you've got health departments, you've got county and state agencies, and the federal government. So can you talk a little bit about the challenges of building that relationship, and where do you think the key links are to allow this these digital techniques to be most effective?
Yeah, I can start off, and Lauren, please hop in. So I think in the report, we try to outline coordination both at the state level and then also at the federal level. And what does that look like right now? So there are some specific recommendations for states looking to apply either methodology, but some of our big picture recommendations are, if they haven't already convened a task force around looking at tech and digital issues, to do so and to make sure to have different roles that allow for that cross-disciplinary information sharing, and not just somebody who's focused on the security aspect, somebody who's focused on the technology aspect, a public health official, somebody who's coordinating with the big picture within a state. It's a simple recommendation and something that's likely already happening, but I think it gets to the point of trying to create overlap for example, the technologist to better understand what the manual contact tracer is dealing with, and to think through how this system with whatever methodology would integrate to existing efforts. I think our central recommendation is for a national coordinating body and some sort of a convening forum. I think, at this point, we understand that the federal strategy is fractured, and in terms of really being able to scale some of the considerations, whether it's for what security standards should be put in place, potential data, really just getting a good brief about both methodologies, and then thinking through longer term execution realities like the airport problem. Having an ability to convene state executives, public health officials who are working with those executives across states, with technology companies, with the civil society groups who are already trying to serve that coordinating function, to just have some of these conversations right now, we think is really imperative for the potential long-term success of potentially using these methods. So we've suggested groups like the National Governors Association, public health officials who are working with states, and then other groups that have popped up to try and help this coordinating effort to work together. And thankfully, we are able to be on some conversations that are trying to assess the reality of that type of convening already existing. It was important for us to think about a suggestion that could already work within existing organizational structures to make kind of that quick response a possibility. And Lauren, please add in about how we thought about this body and then some of the other stakeholders that we write recommendations for too.
Sure, and it's a really great point, and that you just made on what are the existing organizations that are working on this, and not trying to sort of recreate the wheel or anything like that, because there are a lot of disparate but impactful and important organizations looking at the issue just from different perspectives. But really, there are two issues here that, we think that a coordinating body could really help with. And that's number one, these questions that the states are dealing with, both from a technological and a policy perspective, are really hard. And, officials are really grappling with so many different things related to this crisis. And then, of course, every other thing when it comes to state management. And so we think that coming together, you could really help to scale those decisions. Again, what Maria said, set some guidelines, some common goals and procedures and practices and things like that could really help states. The other thing is that technology is meant to be assistive. And I mentioned before, it's not a panacea or a silver bullet. And so, given that, and then given that, states are trying to figure out how to do this, we know that there's this big gap, and that bringing people together can really help to fill in that gap. So that's the reasoning behind, our central recommendation. And we do think that there is some momentum behind that between, from different stakeholders that we've been talking to.
It was interesting this week, Governor Hogan in Maryland announced a group of governors, the other NGA, the National Governors Association, that will collaborate on doing rapid testing. And so they sort of interesting networks that are forming, which is, again, critical to the solution. So last panel, we had several technologists talking about efficacy of how reliable our testing and public safety. We had a computer engineer, Dr. Choi, talk about in detail how effective the testing, both contract tracing by phone calls and some digital apps, have been in South Korea. And I'm wondering, this report was written to a US audience, but how much did you look at other countries? And where are some of the success stories? And also, where are the countries that didn't do well with this technology?
So Maria definitely looked at more of the European side, and I definitely want to let her kind of go into some of the areas where we think, they succeeded there. And, I just kind of look more on, the Asian side and not in too much depth. We knew that there were some successes. We knew obviously that, different governments and different societies had different levels of success, but also, why were they different? So, even if they were democratic, and we just know that the societies are different. They had different digital infrastructure, for instance. So some countries had already dealt with some other outbreaks before, and they had the benefit of implementing that policy and that infrastructure beforehand. Obviously, having smaller, maybe more centralized governments, and then aggressive testing and kind of a more collectivist attitude. And, anecdotally, we heard different apps worked better than others, but it's hard to compare because our country is just so different from those other nations, even, again, if they're democratic. Maria, I'd love to turn it over to you.
Yeah, no, absolutely. And I think building on what Warren mentioned, so the central recommendation that we just talked a little bit about was kind of assessing what have other countries done. And so we'd heard successful, privacy preserving measures, and also some of those things being questioned with kind of smaller populations in the US. And it was interesting, we note in the report the European Union's efforts to try and coordinate across the bloc. I think as well because of some of these mobility questions. So we highlight the European Union's Pan-European Privacy Preserving Proximity Tracing, PEP-PP, project that was trying to coordinate across the bloc and scale, development standards, security standards. And we think that's an interesting model, especially for the U.S. context as well, and given our population size. In the report, we also talk and highlight a little bit around Denmark's use of location data. And even though it's not still tied to this digital contact tracing or exposure notification, we thought it was still an interesting counterpoint. So what Denmark has done is that they've used location data. However, they've used it in an anonymized and non-user specific aggregated way, which I understand some other European countries have also done. But part of what was interesting about their approach was the concerted kind of public-facing communication and then implementation effort. So on the public side, I think they really tried to make it about a trusting process, a communication, and they made the decision not to go the exposure notification route, meaning that you're not getting the data about an individual potential exposure when you've crossed somebody, or when you might have been in contact with somebody who has tested positive for COVID, which is the hope for digital contact tracing to help see those connections a little bit more clearly. Instead, the country is working with this aggregated data for decision making, and then they've also rolled out another app that allows users to track their symptoms. So there are different pros and cons, and something that we mention in the report is that there's obviously a trade-off between these methods and how beneficial they are to your mitigation efforts. So it's a little bit outside of the context of digital contact tracing, but also an alternative approach that's been used in trying to use the data for decision-making purposes. I will mention lastly that we were in a conversation within the past week where I think there was an interesting framework raised around Germany's contact tracing efforts and how I think the way that it's been used is to assess risk. And it's also something we heard in our research, that if you are using contact tracing and somebody gets an exposure notification saying you might have been in contact with somebody who has now tested positive, you use it as an individual. What does that mean to you? If you get 20 of those a day, what are your next steps? And I think an interesting thing for us to further explore is I think in Germany, how they're doing it is, okay, I should go get tested. But so what does that look like for us? If we put that system into place, how does it help as a risk assessment tool?
Mm-hmm. There was a lot of excitement when the idea of Google and Apple developing a software, the GAIN platform or GAIN application. I guess that was announced initially going forward in the spring, but do you have any understanding, have any states or local governments tried to build, you use this analogy of a layer cake of based on this GAIN platform, developing their own API and trying it? I guess the Utah example was not an example of that, but are there any?
I'll be honest, I actually don't know if there are any states who are actively working on an app to sit on top of the Google and Apple API. I know that there are a lot of states asking questions about it. Again, do we make this investment? What do we need to do? What are the considerations that we need to think about when doing it? Maria, do you have any sense for any states working on an app for that?
No, I don't. And I think a lot of the stakeholders or kind of collaborating partners we mentioned in the report, like the COVID Tech Task Force or the U.S. Digital Response, they and also MIT PACT have been consulting states about how they would use this technology. But as far as I know, there isn't a state that's actively using it. And I think in some ways that tracks with what we try to articulate by the cake visual in our report. And trying to just lay out what is the ecosystem that you have to build to utilize this notification solution. And I certainly think, though, it will continue to be something that that states look at, especially for the privacy preserving feature. And we think, having some sort of a national convening forum might even allow states to help figure out maybe there's an app vendor that will service multiple states, or they can set specific considerations around how the app vendor is utilizing data. So we're excited to see the development of some of those conversations, and we'll stay tuned about how more states end up utilizing this. I do think, though, some apps may have been cleared by Google and Apple to use their OS, and I'm not as familiar with that, but I think that's something we've heard through our conversations as well.
And we also,
I'm
sorry, I was just going to say if there were, maybe one vendor or even, going through an organization like the U.S. Digital Response or the COVID Tech Task Force to build such an app, maybe it's not a third-party vendor, maybe it's a service organization or a volunteer organization that, again, everyone sets those particular guidelines.
Mm-hmm. We've had several panels, and we've heard from a number of people who are concerned about their own vulnerability with these apps. In particular, concerns of immigrant groups. We've had minority groups that feel that these technologies could then be used after COVID. In your analysis, which groups did you feel were the most vulnerable?
That's a great question. Yeah, Lauren, I would love for you go ahead and add what you were going to add. I'll talk a little bit about some of the legislative recommendations we made, because I think they speak to the long-term use of this. And I think specifically with some of the methods, there's concerns about how that individual data is used.
Yeah, absolutely. The groups that you just mentioned, Dr. Price, immigrants in this country, minority groups, absolutely. Something that we've heard anecdotally. We haven't done the actual research to, to really look into it, but anecdotally from different experts in the space, we've heard that, there are law enforcement organizations that have requested this data. So that's very concerning to us. So the groups that you mentioned, potentially, abuse victims, witness protection, and then one particular group that I was thinking about are actually national security professionals who, you know, in the intelligence community, for instance, who wouldn't want to be tracked. You know, I think they're probably, you know, not a group that you might think of, but obviously because that was my previous life, that was something I thought of as well. And again, that data could be very attractive to, you know, some particular legitimate institutional groups or other nation states or criminals or things like that. Maria?
I think especially with the vulnerable groups that you mentioned, Dr. Price, and others that we haven't included in the report, I guess, you know, this goes back to likely what you may have heard from testing, those who are real experts in how testing is working and how manual contact tracing is working. The reality of being able to accurately understand exposure through every single person, we have been told in our research is vital. So if there's a public trust component that keeps vulnerable populations from sharing information that helps decision makers in the mitigation process, then we're failing at being able to successfully respond to COVID-19 and how we're going to kind of move past this phase. I think to that extent, we had two brief but kind of important recommendations, at least for Congress, which focused on some of what we've mentioned already. One, you know, trying to put some safeguards in place for individual health data that's reported through application vendors to public health officials with COVID-19 specific applications. We think that's really important. And so that's one element. The other kind of speaks to how that long-term data could be used, or like Lauren mentioned, some of the examples that we've heard with who's requesting that data. We really think that there needs to be guidance around the responsibility of data use and storage, and then also some sort of a sunset provision about how this data is destroyed or no longer able to be utilized, you know, once we move past this chapter of COVID-19.
That's a really important point, and it plays off with one of the questions from our Facebook Live viewers, which I'm sure a lot of people wonder about, is who holds the data? Is it held by the government or big tech companies? What would you recommend?
So really, it depends, to be honest with you. Yeah. You know, I think it really depends on how the state officials want to set that up. Because again, you know, the tech companies are not, there's no real laws to guide their collection, their storage, their use, their selling of that data. And so these states that decide to develop an app really need to go into that development with eyes wide open and know exactly how they want to store that data, use it, collect it, et cetera. And we actually recommend, you know, not collecting, you know, any data that is not needed. But then, of course, you have the whole integration with manual contact tracing, you know, and how, you know, they're likely going to handle some of that sensitive data. And so we also recommend in the report, you know, at a minimum, that contact tracers use some very basic cyber hygiene solutions, multi-factor authentication, use of VPNs, strong random passwords across accounts, encrypted messaging, that sort of thing, to deal with that. Maria, did you have something to add?
No, you know, I would just say that it's a difficult question based on how this will be used, and obviously for every state this will look different. I think overall, though, you know, the Google Apple exposure notification, they require public health officials at the state to give an okay to an app, and I think that method's way of hoping that some of these questions will be answered by the state. And we include a resource for vendor management, both on the security side, but we hope that some of these conversations, whether it's within a state task force or coordinating with other states, could help set requirements for vendors to be transparent about how they're using this data, especially since it's health-related data. And we encourage that and think it would also be a helpful piece of a public trust and communication transparency strategy to overtly share how this data is being used, and that will bolster the success of using methods like digital contact tracing.
I think that note of trust in the system, that's fundamental, and I don't know how we fix that. It will take, I think, a concerted effort in messaging. Believe it or not, ladies, we are out of time. It is so wonderful to hear about your work. The Belfer Center is really leading the way and doing asking important questions as we try to come up with various approaches to address this public health emergency. I just want every listeners to know that this work is possible with the support of the Henry Luce Foundation. We have very grateful to Maria Barsallo Lynch and Lauren Zabierek for their thoughts. The report will be available. We have a spotlight coming up on August 18th with Mr. Victor Madrigal-Borlos, who works with the United Nations, discussing this technology and the LGBT community, and many examples outside of the US. I think that will be an important discussion as another potential vulnerable group. And I just want everyone to know that all these panels are available on the EthicalGEO website. So if you missed them and you want to learn more, check it out. We're very interested in your feedback and comments, and we thank you for participating. Both Maria and Lauren, thank you all for listening. Come back and listen again sometime soon. And with that, we're going to close the panel. Bye. Thanks.
Thank you. Thank you very much.